Good afternoon. My name is Lynn Johnson. I'm the chairman of Orleans County Legislature. We are living through history right now, and not the good kind. Watching the news is scary. Our social media feeds are scary, and for our essential workers, going to work is scary. Now is not the time to under-communicate, and that's why we're having these video conferences as often as our public health director can put us in front of the camera. We are strong and we can get through this together. Amidst the craziness of COVID-19, though, we have so much to be thankful for. And we need to remember that during this Easter season. So I want to take this time to wish all of you a happy Easter, and at this point introduce our Public Health Director, Paul Pettit, for our situational update this weekend. Paul?
Thank you, Chairman Johnson, and appreciate the introduction and the words that you just shared. And again, we all are focusing on the holiday this weekend here, and it's very important as we continue to talk about COVID-19. We'll be discussing that in a little bit around, again, some thoughts to try to keep families safe as we move through this difficult and challenging time for all of us. So again, my name is Paul Pettit. I'm the Public Health Director for Genesee and Orleans County. And we're here again on Friday doing our weekly update. Obviously, we did one this past week on Tuesday. And we felt we needed to do that due to the significant increase in numbers we are seeing in the beginning of the week. And as we'll talk about a little bit today, throughout the rest of the week, we have seen those numbers continue to rise. And we're continuing on that trend to some extent as we head into the weekend. But as I start, I just wanted to say a couple words here around things that I wanted to reach out and thank all the members of our community in both counties, Genesee and Orleans, that are really buckling down and working hard at social distancing, at adhering to the different guidance that is out there. We know it's very difficult and challenging and not something that any of us want to be doing. None of us want to be spending all this time per se at home and not out enjoying the different activities that we all enjoy and like to do. But it's something that, we have to take serious. And I want to, again, thank those folks that are taking it serious, that are staying home as best they can, social isolating, following the guidance that is out there. And I appreciate that. And it's definitely taking sacrifice to do this. And it's very important as we continue to see these numbers increase. And then also on the flip side of that, we do continue to receive reports and concerns of groups that are gathering large numbers, different businesses that may not be adhering to the guidelines. So on the flip side, I also want to challenge those folks, to be considerate, to think of others during this time. What you guys and individuals and groups decide to do impacts all of us. We're in this community together. We've been saying this for several weeks now. In order for us to succeed and get through this, we have to come together and adhere to the guidance and social distance and do everything that we can in order to get us through this time as quick as we can. So what we're going to do is typically what we've been doing in these live updates. I'm going to talk through some situational updates here. I have some other information that I want to share, and then we'll be opening it up for questions at that point. So we're going to unmute our media after I get done and allow them to ask questions. We're keeping our fingers crossed that we won't have any technical glitches today. We do apologize again for the inability of the last couple of these to be able to hear some of the questions. One of the things that I enjoy about doing these live ones, so to speak, or video taped ones, is that we can have dialogue and we can answer some questions versus just media pushes. So anyways, we're going to open it up at that point, and we'll go from there with answering some questions until we run through our time. So again, situationally, new cases for today. In Genesee County, we've received 7 new positive cases of COVID-19 for a total of 70 cases now. So again, that's 7 new since we reported yesterday for a total of 70. 6 of these individuals reside in the central part of the county, and 1 individual resides in the western part of the county. 2 individuals are in their 20s, 1 is in their 30s, 1 in their 60s, and 3 are in their 70s. 3 of the new positive cases were under precautionary or mandatory quarantine when they became symptomatic. So again, they had orders upon them to be quarantined prior to becoming positive. They became symptomatic and we swabbed accordingly. In Orleans County, we have 0 new positive cases today. We still remain at 24, same number we reported yesterday. And we do want to report that one of our positive individuals has recovered and is out of isolation. So we need to celebrate these victories when we get good news on some of these. It is nice to see them move through and now come to the recovered side. So we're happy to see those, and we're hoping to see many more as we move forward. So again, 0 new positive in Orleans today. So our mapping tool, we launched that last week, and we've received good feedback on that, and I believe it's been helpful for a lot of folks to be able to reference as an ongoing active tool to track COVID-19 in our communities. And as I mentioned earlier this week, we were adding in different age groups. And as I reported today, as you just heard, we are trying to put people in categories of decades so that we can better report out a little bit more of some of the individuals that are testing positive and what age brackets they fall in. And as I mentioned earlier in the week, the reason we really want to do this is to help people see that this is not just impacting our elderly folks and those that may be in their 70s, 80s, 90s, etc. COVID-19 has no blinders on it. It affects anybody. It can infect anybody. And we're just trying to show that a little bit better by showing the age brackets and the groups as we move forward. And on the mapping tool, you'll be able to see that. There's going to be a tab at the bottom of the map section that will allow you to actually click and see the different age brackets that we're talking about. And again, we're hopeful that this will be helpful to show and help to inform folks that and reaffirm that everybody's susceptible, even though you may not get overly sick. Again, knowing that 80% of folks or so, luckily, don't have severe symptoms, but ride through COVID-19 fairly easy. We do want to, again, remind folks that you are in touch, potentially in contact with other people, maybe parents, grandparents, other immune compromised, folks with underlying health issues that may be susceptible. So even though you may feel invincible or you're able to weather COVID-19 quickly without many symptoms, we need to continue to remember to look out for others during this time and to protect them by making sure you're informed and staying as protected as you can. Another thing that we want to announce is, unfortunately, we did not have it ready to launch today, but we are going to be launching a town breakdown of positive cases. I'm well aware over the last month plus now, there's been a certain group and certain level of residents that want to see numbers by towns. And as we've been articulating over the last month plus that with our small communities, it's very difficult sometimes to report numbers that way. We're very cognizant. We want to make sure we adhere and we protect health information of all of our residents, no matter what the disease is. And when you have small communities, it's one of those things that it's hard, especially when you have really low numbers, to be able to do that successfully. Here in the Go County region, obviously, we're pushing 100 cases now between the 2 counties. And we do feel that we're at a point now where we're going to start to provide a little bit more of that information. So again, when we report out numbers starting next week, we will be including towns, and on the mapping system, there will be a layer again that will provide those town breakdowns. We are going to be somewhat separating, disassociating the cases from the towns, from the age groups, again, in an effort to protect HIPAA and protect people's health information. So again, we're going to do our best to help people be informed, but also protect residents' information. What I do want to, again, reiterate here is the important piece is not the town. We've been saying this is one of the reasons we have not been reporting this way. COVID-19 is widespread. It's prevalent throughout Genesee County, throughout Orleans County. There is no town, no community that is untouched. We don't want people to have a false sense of security if they don't have a number in their town at this point. That does not mean it's not there. We know that it's prevalent. We know there's a level of folks that have been positive more than likely that had mild symptoms and may have recovered on their own. They stayed home because their doctor told them to self-isolate for a few days. Swabbing wasn't available. So again, let's focus on protecting each other, staying away, social distancing, and not really hone in on those town numbers. But we will be making those available starting next week. Contact tracing has initiated for all the new cases, those 7 new cases I mentioned specifically in Genesee County. Ongoing contact tracing continues for all the other ones as we continue to explore and investigate those cases, trying to identify those close contacts. And again, those folks are placed under mandatory quarantine and or isolation, and they're swabbed as indicated. So if they become symptomatic while under quarantine, they will get swabbed, and if they are positive, they'll move over to isolation. All right, so one thing I did want to clarify on the contact tracing piece is we've had some different questions around some of our other facilities in our communities, like nursing homes, the VA, the detention center in Batavia. These facilities are overseen and monitored by the federal government, by the state government, hospitals, for example. The local health department does not have jurisdiction over these facilities. So when we do receive positives in them, those positive cases do count against our numbers. So when we report our numbers, if there are positives in those facilities, they are recorded because, again, they're considered our residents while they're in our care in our communities. But we do not do the case contacting in those situations. That is done by either the federal government or the State Department of Health, depending on who the regulatory agency is. We are in a supportive role. We do work with them collaboratively. And any of the community members, so the workers, the guards, anybody that visits those facilities that live in our community are under our care. So we work collaboratively with them. If there's any direct contacts, we then are in charge over them. We would place them under quarantine and, again, swab as indicated, and potentially put them under isolation if needed. So it's a little bit different when it comes to some of these different facilities, how we work with them and how we oversee the community part of that. But just wanted to spend a little bit of time clarifying that, because I know we've been starting to receive a few questions in regards to that. All right, and then just another reminder, if and when we need to report a public area, because we have someone that may have been there and we can't firmly and adequately feel comfortable knowing we've identified close contacts, we will be notifying folks. Again, generality, if you've been at X business at X time at X day, to notify the health department and or your healthcare provider and watch for symptoms. Fortunately, again, my folks, my healthcare team, the epidemiologists and nurses have been very, very successful in doing case contacting. And again, for the purposes of following the state guidelines, we're going back 48 hours from that confirmatory test or when they became symptomatic, and identifying any close contacts from that point. So at this point, we have not had to do any of those public releases. So I just want to assure folks that our team is looking and trying to identify those close contacts, and we are placing them under quarantine when we find them. All right, so again, cumulative data-wise, I'll just run across our numbers real quick, and again, those will be available on our mapping tool that's going to be updated here and released shortly, I believe. So again, Genesee County has 70 positives, 319 negatives. We have 49 in isolation, 98 in mandatory quarantine, 1 in precautionary quarantine, 1 death, and we have 20 that have recovered. In Orleans County, we have 24 positives, 218 negatives, 18 in mandatory isolation, 56 in mandatory quarantine, 0 in precautionary quarantine, 0 deaths, and 6 folks have recovered. And then again, you'll be able to see the total cumulative between the two counties and the age breakdown later on the map. So a few other operational updates I just wanted to share real quick today. Swabbing continues to be hit or miss around our communities. Again, would like to come here with better news that anybody that wants to get swabbed could, and it would be able to, but unfortunately, we're still not in that position. Unfortunately, the state and the different sources that we try to get these swabs from, it's still not available. Healthcare systems, different providers do have differing levels of swabs. Obviously, we know UMMC in Batavia specifically has their tent city set up, and I know there are several independent providers in our communities that are doing swabbing, but again, they're doing it based on screening criteria. They're focusing on our highest risk folks, again, our seniors, our immune compromised, those with underlying health conditions. So if you're symptomatic and you fit into those categories, they more than likely will be able to swab you. Unfortunately, if you don't fit into those categories, more than likely they're going to tell you to self-isolate at home and act like you're assumed positive, so to speak, until you're able to potentially get a swab, and self-isolate from others while you're symptomatic. So again, we're not in a position to do community swabbing. We are working hard and continually pushing state and federal partners to provide these swabbing kits for us so that we can have a better understanding of what's going on in our community. Again, going back to the mapping and the town level, We know it's everywhere, and if we were able to swab and test for it, I think we'd have a much better understanding of what's going on truly in our communities. But without that, we have to continue to practice and adhere to the social distancing and making sure, particularly, we're staying home if we're sick. We're not going to work. That's one of the biggest things we want to stress, especially now with folks being able to work at essential businesses, etc. Do not go to work if you're ill. If you have any symptoms, stay home. We know that there's a certain percentage also of asymptomatic transfer. So it's just very important to be very cognizant of your health status and how healthy you're feeling relative to any level of symptoms in regards to COVID-19, and that you're not going out and not going to work if you have any of them. We need to really, truly protect our coworkers and protect others in our community. Again, we talked about a little bit earlier, this is obviously a very important holiday weekend for us, and unfortunately we're in a situation with these extreme mitigation and social distancing measures in place that we're not in a position to celebrate corporately like we would like. And it's just a reminder to everybody, we fully understand, and we're all in different levels in participation of this holiday, but the reality is it's difficult, it's challenging. At a minimum, there's a lot of family gatherings that typically occur. And, unfortunately, this is not the weekend to be doing that. And we just want to make sure that folks are aware that there are regulations in place, there are restrictions, and we're asking people to adhere to this. As painful and difficult as it may be during these holiday times, it's very important. We do believe that our numbers are lower than they would be if we were not socially distancing. And we're thankful, again, for those that are taking this seriously and practicing social distancing during this time. And we need to continue to do that. So I know a lot of faith-based organizations have alternate plans for this weekend using social media and different unique ways to reach their congregations. So we'd encourage everybody to worship and do what they need to do corporately through these social distancing means. Enjoy small gatherings with family, use FaceTime, use other methods to connect with them maybe after dinner, so that again you can still have those connections while remaining apart. Again, hopefully this will be temporary, and as we move forward we'll be able to be in a better position not to have to do this for much longer. All right, so also just another reminder that the CDC recommendation in the state of New York has moved towards recommending wearing masks for folks when they're out in public. So again, we've been very close in following whatever the CDC and state guidelines are around these issues. So again, here locally in Genesee and Orleans County, the recommendation is that you consider wearing a mask when you're out about in the community. And again, there's a lot of different materials and blueprints online for how to make these if you want to make your own. Unfortunately, they're not readily available in the stores, so to speak. There's still a huge backlog, and we would encourage folks to be creative, make your own. And I've heard many great stories of individuals and communities, different organizations in the community stepping up and making these masks for providers, for other organizations. And again, it's just another great example of how we're coming together as communities to help rally and to help support one another during this time. Again, mental health is available. We've talked about this frequently, that if you're feeling stressed, if you're feeling anxious, there is help for you. You're not abnormal. You're not strange if you're feeling anxious and just a lot of anxiety during this time. It's to be expected. And if you're having those issues, we want to make sure that you're aware there is help. Our behavioral health, our mental health departments, different agencies within our communities are available. We have 24/7 support in our care and crisis helpline. We want to make sure that you have that information. It's included in all the different documents that we continue to push out. And if you need it, call it, contact them, reach out to them, talk to a loved one, whatever you need. We don't want anybody going through this time alone and suffering more than they may need to. There's also an app that's been out and that's been put out by the state of New York and the governor's office called Headspace. And that app is free and it's available. It includes different meditations, sleep, movement exercises, and different things that may help folks again during this time to find some different outlets and way to deal with some of their anxiety. So again, that information and those apps are available free to download for both Apple and Android systems. Again, the guidance on essential and non-essential businesses continues to change. There have been some updates made to that. I know there was some press put out yesterday around golf courses. So that continues to evolve. The governor's list is expanding on what they consider essential and non-essential. These decisions at that level are made at the state, so we obviously have to follow them. They're put in place by them at the state level. So I would encourage folks to continue to monitor that list as it changes. It is very extensive, and if there are any questions on whether you may be an essential or non-essential business, there's a number or a website that you can go to and ask your question on whether you should be working or not, or open or not. So we'd encourage folks to do that. Again, if you happen to be working for a business or an agency and you have some concerns whether you're essential or not, there is, again, sites, again, to the Department of Labor, et cetera, that you can call and check into that. Also, New York State pause. Again, this is around enforcement of the different social distancing recommendations and requirements that are in place. So if you are concerned that a business may not be compliant, or for bigger gatherings in the communities, there is a place that you can call, and that number goes again to the state, and then that gets pushed back down to the locals to respond and check into it. All right, so I'm just going to wrap this up with my report, so to speak, and then we can open it up for questions at that point. But as I said, and that we've been articulating through many different means, we are continually asking folks to think of others during this time. We can't stress this enough. We are all in this together. This is a collaborative effort to try to move through this difficult time together. We are seeing these significant increases in numbers, and we unfortunately will probably see that again for another couple weeks. If you look at previous places before us, specifically New York City, in their climb up to their apex, again, we're 2 to 3 weeks behind them from all the indications that we've been able to see. So the numbers climbing are going to continue to do that, which is why now is the time to really buckle down and do our best so that we can push through this together. Again, this is a difficult time for all of us. Nobody wants to be doing this and dealing with these restrictions and the disruptions to our normal lives that we've become accustomed to. But again, by working together, working collaboratively, and following the guidance, we're very hopeful that we can get through this quicker and get us back into some sense of normalcy. So with that, I'm going to unmute our media folks. Again, if for some reason we have problems, or if you're not unmuted and you happen to be from the media, please type that into the chat box and we'll make sure we get you unmuted. And I will entertain questions, again, if they're for me. If not, I know Chairman Johnson's here, and down in Genesee County, I know Jay Gazelle, County Manager, and I believe Shelley Stein's on to answer any appropriate questions.
Paul, this is Dan Fisher at WBTA. Can you hear me?
I can hear you, Dan, loud and clear.
Well, there we go.
All right, go ahead.
Success. Paul, earlier today, Governor Cuomo said that the key going forward, at least in his opinion, is testing for statistical purposes, to be able to better identify trends. A, do you agree with that? And B, do we have to have testing on demand in order to recognize when this is over?
Well, we've been talking about this, and I mentioned earlier with the swabbing and the testing, I do believe that we need to have better testing. To truly understand the impact of what's going on in our communities, we have to know how prevalent it is, right? We have to know where potentially our hotspots are in different areas that we need to try to lock down and contain. And we've been very aggressive, again, within the health department when we do get positives to be able to work towards containing them with direct contacts. Unfortunately, when we don't have widespread community testing and swabbing available, we don't have the full extent of our positives. Again, there may be folks out there that are positive that we just don't know about. So I do believe that the testing is key in understanding how prevalent it is and understanding potentially how much of our population has had COVID. Again, antibody testing on the flip side of this and trying to understand maybe who has had it and now is cleared and presumed to be protected. Is also very important for us to know that those folks are potentially able to go back out into the community and start working again and getting things going again. So testing is key, and I fully believe that hopefully we'll get to that point. Unfortunately, we're continuing to struggle in getting there, specifically locally, but we're hopeful that that will happen soon. You want to ask the second part of your question again, Dan? We lose Dan? Okay, other questions? Dan, I just couldn't remember exactly what the second part of your question was, so.
Paul, it's Tom Rivers.
Hey, Tom.
You know, I don't have the map right in front of me, but I think most of the cases are in the central part of both counties.
Mm-hmm.
And I don't know if you have any thoughts on that, why that might be.
Well, I mean, I think the simple answer is going to be we have big population centers. Obviously in Orleans County, we have the village of Albion and Albion proper. And then obviously in Genesee County, we have the city of Batavia. So I think if you look across the state or any of these hotspots with COVID-19, you're seeing specifically larger numbers and larger activities within the population centers. And I think that's obviously just due somewhat to number of numbers, but also we have folks that are living closer together potentially in these areas. And these are commonly places where people come in and, obviously shop and do other activities where there may be more interaction. So again, that would be my answer on that. We typically see more numbers where we have our bigger population centers.
Yeah. And if I could just ask the people, let's say the younger people under age 50 or maybe under age 60, I don't know. I wonder if they've been badly sickened, any of the younger people. And I do know the person in Livingston who died. Mm-hmm. But in general, I don't know if they're able to knock this off without a lot of trouble.
Well, again, let's go back to data. I think that drives, again, hopefully a lot of our decision making. It's still developing, right? But what we've seen so far is that, there is a percentage of younger folks that are still hospitalized that unfortunately may be dying. A lot of the folks that are in that category have had underlying health issues, other comorbidity issues, so to speak. And I think that when you get into that situation, you obviously are more susceptible to potentially having some negative outcomes. Now, again, when you get above, the age groups you're talking about, there's a higher risk factor because, again, people's immunity start breaking down over time. And, they're more susceptible to viruses like COVID-19. But, again, the whole point in trying to put the different age brackets out there now is to help show folks that you're not immune from this. People are getting it at every single age group.
Okay, thank you.
Yep.
Okay, from Chairwoman Stein.
Sure. Hey, Howard.
Hey, can you hear me better today?
Loud and clear, Howard. Shoot away.
Good. Great. So I've got like 3 or 4 questions myself, and if I could, then I've got 3 questions that I wanted to ask last week from a reader and that I think are still relevant.
Can we start one question at a time?
I will do that.
Thank you.
I just wanted to prepare you what's coming.
Okay.
Regarding the governor talked today about flattening the curve and said, in New York City they're flattening the curve, and he also said we're seeing that in upstate. And you look at Orleans and Wyoming counties; those are numbers I get, you provide, and I also get Wyoming County. The numbers seem relatively low there. We're continuing to see high numbers here in Genesee County. Where are we on the curve, and why do you think we're not seeing the same kind of low numbers that we're seeing elsewhere?
Well, I mean, I would say, obviously on the mapping tool we put up, you can see there's been a significant climb over the last week, particularly. I mean, when I stood here a week ago, I think we had 22 cases in Genesee County, maybe. And I think it's indicative, again, if we're following the time frame, so to speak, when we look at the apex and curve. We've always maintained that we felt we were 2 to 3 weeks behind New York City based on when they started seeing positive cases. I do believe, again, that our numbers are lower than that they could be if we were not practicing our social distancing and being as effective as we were, getting the schools closed, getting people apart from one another. It makes me shudder a little bit to think of, potentially the case numbers we might have had if we still had our kiddos in school longer and just all this social interaction that we were fortunately able to put restrictions on fairly quickly as soon as cases started occurring downstate. Again, on the level of the curve, I do believe if you look at most of Western New York and the central New York, we're all steadily climbing upwards still. I don't think anybody I've seen recently is plateauing anything, probably Syracuse west. So I think that time will come, hopefully sooner than later. But again, I think just due to the lag and seeing onset and community spread in our area, we're just delayed a little bit.
So I can't remember if it was last Tuesday or last Friday, you mentioned rather briefly that, if I understood correctly, you projected at the apex we might reach a point where, like, our local hospitals needed 100 beds. And I know you're a big data guy, so I wanted to just ask you, kind of modeling, if you've done that kind of modeling, if that model is revised at all for you, and related to that modeling, any idea how much community spread there might be out there that isn't showing up in the positive tests, either because people are asymptomatic or they're just not getting tested?
Yeah, good question. So I know there's some additional modeling going on right now. We're working actually collaboratively with a regional approach with Monroe County to look at modeling, because as you're well aware, our healthcare systems are part of the bigger systems out of Monroe County. So there's a lot of again, approach looking at what's going on as far as bed capacity and bed needs. And I think it's been fairly well documented the last few days anyways, on a statewide level and nationally, that fortunately, to date anyways, the need for hospitalization and hospital beds is not what we thought originally or thought a couple of weeks ago. So I think, again, there's been, fortunately, a less need, that the beds and the doubling of the beds that the governor was asking for, we're not seeing the need for that at the moment, which is a great thing, and we hope that continues. We would love to see that trend continue to move forward. But modeling is something that, again, we continue to take a look at. I do know locally in our healthcare system, we do have capacity. We do not, fortunately, out of all the positives that we have, there's very, very few that are in the hospital. Most of them are at home, and they're recovering at home, which is the best place for them to be.
So in Genesee County, we have 70 positive cases. Are you able to say how many could be attributed to that single business location that was mentioned in a previous briefing?
No, I can't speak to that directly. I would say that we continue to add them into the pool, and it really doesn't change anything from our perspective on the epidemiological and the case study side. Again, any positives in our community, regardless if they're at one business or multiple businesses or just community spread, we treat them all the same. We work, aggressively to find close contacts and to put them under quarantine to contain that spread.
Great, thank you, Paul. So now on to the reader questions. The first one was about testing and the kind of delays. I know early on you were looking at several days delays. Wondering if that is persisting, and one of the main points of this question is the reader's wondering if you could include in your data, when you get positive test results, what the lag time was, how many days between the time the test was administered and the results you got back, so we might have a better idea of how long this might have been out in the community. Yeah,
so good questions. The reality is, I believe our turnaround time on the tests after we swab is getting better. We're actually getting some results back the next day. So when we started this process, a month plus ago now, we were getting results somewhat the same day. And we went into this black hole of a week, 2 weeks for some of these results, unfortunately. But I believe that is picking up. So we are obviously, it's a rolling submission, and we send ours actually through the health department, through our different labs in the Western region, and we are getting results back pretty quick. I do believe the average, I would say, is probably 2 to 3 days at this point, but some are coming back quicker. So I believe that's probably indicative of additional lab capacity coming online, again, which is a great thing. As far as some additional data and capturing how long it takes and some of the other nuances of that question, I'm not saying it's something we couldn't track, but I will tell you we don't have the time and capacity to track that. It's just one of those data points that, again, is someone that enjoys looking at data and studying different trends. That's all good stuff to have and good things to note. But the reality is we're really working hard to bring forward the information we have to you all as real time as possible, and most importantly, as accurate as possible.
The other question this reader had is about public places, certain businesses, grocery stores, other shopping areas. And I've heard complaints from several readers over the last couple of days when they go to the store that people aren't wearing masks. They seem cavalier about the social distancing, to put it nicely. And this reader asked, should there be, a law enforcement presence to enforce this? Do you think there should be more supervision of any kind to get people more aware or to comply better to social distancing when they're out in public?
Yeah, I mean, that's a tough one. As I said in my intro here, I thanked everybody, a lot of folks that are working hard and doing the right thing and realizing we're all in this together. But I also recognize that there's a certain level that are maybe not adhering to the guidelines and out doing things that they shouldn't. And businesses I know around our towns have taken some more proactive approaches. They're monitoring the number of folks that are in the store. They've put up different tape marks, I think, to keep people apart from each other in line, those different strategies, obviously wipes and ways that people can wipe down the carts and wash their hands. So I believe there is a good faith effort at some level by a lot of our businesses to be partners and help encourage social distancing. It's not a perfect method. As far as the mask in the store, again, we're seeing more and more people do that when they're going out, but this is not a mandate. This is not a requirement at this point. It is a recommendation. And again, that mask is to protect others from you, as we've talked about. So, again, this is something we want people to think about and potentially have access to masks or make them, to consider wearing them to help protect others. But again, I would challenge businesses that maybe still have some work to do, right? They still have some time to go to maybe meet some of these challenges and some of these concerns and complaints. We want you to partner with us. We want you to be part of the solution in helping to keep folks apart. So again, any strategies that you guys as business owners can employ within your businesses to help keep people apart, to help keep people safe, it's only going to help add to us all hopefully staying safer.
I think that's it for now. Thank you very much.
Thanks, Howard. Other questions?
Chairwoman Stein. She would like you to address the relatively young ages of the positive cases in Genesee County. Is this due to young folks not being aware they can spread the virus?
Okay, so there was a question from the Chairwoman Stein in Genesee County asking about young folks and positive cases in that group, and are they aware they can spread the virus? So, again, this goes back to what we've been talking about, and obviously I'm happy to reiterate it again. Anybody can get COVID-19. Anybody can spread COVID-19. And one of the biggest concerns that we have, especially under, unfortunately, some of our younger populations, is they're not taking this seriously. We've received many complaints at different areas within the communities, potentially at parks and other gathering areas where, younger folks are not adhering to this. And again, you may feel that you're invincible. You may be able to shed COVID-19 fairly quickly without any major health issues, so to speak. It just may be a bit of a fever and a bit of a cough, et cetera, and you're back and running in a couple of days. But what I want to reiterate and focus on, again, you can pass this along to other family members, to others that you may definitely don't want to pass it to, right, where they may not have as good of an outcome as you could have. So it's very important that, again, parents, if it's your children that may be out and about, that, we ask you to, again, look out for them and to help them understand the importance during this time to not be involved in group activities. And if you're out on your own and you're just, of a younger age, we're asking you to do your civic and your social responsibility and think of others while you're out and about and make sure that you're taking this as serious as we can so that we can all be safe.
She also would like you to address the proper removal and disposal of gloves and masks, and littering on the ground is not proper disposal.
Okay, yes, so obviously there's different guidance on PPE. Fortunately, this is not considered a hazardous material, so masks and gloves, et cetera, can be thrown out and disposed of in regular trash. Again, once they're dirty and contaminated, unless they're a reusable mask that you can wash, and again, normal washing in detergent, hot water, and drying is sufficient to clean that. But again, single-use gloves, we want to make sure people are taking them off and disposing of them properly. We don't want to see them. They're obviously not good for the environment to be thrown around and just thrown on the side of the street or wherever we're starting to see more and more of them collect. So again, we're asking you to do the right thing, do your civic responsibility, and dispose of used PPE appropriately. Other questions from the media? Okay, so again, we're going to wrap it up then. I appreciate everybody's time, and I again want to wish everybody a happy Easter. again, enjoy each other, enjoy family from a distance. We hope that everybody's safe and healthy, and we're going to continue to provide daily updates, at least through the push that we hope to get out every day, again, with factual information. And as needed, we will do these live briefings, but every Friday at a minimum. So be safe out there, and we'll talk to you soon. Take care.